Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Our featured research article today highlights the emerging role of high-dose vitamin D in the management of multiple sclerosis. Evidence over the years has shown that people with higher blood levels of vitamin D show a reduced risk of developing multiple sclerosis. So a groundbreaking study in the Journal of Neurology in December of 2015 recently showed that MS patients who were given high doses of vitamin D, 10,400 IUs a day for 6 months, showed a reduction in the type of inflammatory immune cells that are known to cause progression and severity of multiple sclerosis. So there's these certain specific T cells, as they're called, that are a hallmark feature of MS. So in this study, the high vitamin D supplementation group showed a dramatic reduction in the percentage of these damaging T inflammatory cells. And MS patients taking the 10,400 IUs of vitamin D per day also showed a substantial rise in their blood level of vitamin D into what is considered to be the more optimal range. Now, researchers are still trying to determine what the most beneficial vitamin D blood range would be. At the present time, their feeling is that the range of blood vitamin D should be 40 to 60 nanograms per milliliter. That's been proposed, which would be equivalent to 100 to 150 nanomoles per liter. So in some countries they use nanograms per milliliter, in other countries they use nanomoles per liter. So the participants taking the 10,400 IUs a day of vitamin D in this study were able to reach this sort of optimal range. Whereas the group given the low dose of vitamin D, who only took 800 IUs a day of vitamin D, their blood level didn't rise into the optimal range, and they didn't show a decrease in the inflammatory immune cells that are linked to MS. Now, presenting at the American Academy of Neurology in 2009, Dr. Jody Burton revealed results of another vitamin D trial in MS patients. And this study showed that high doses of vitamin D, 14,000 IUs of vitamin D per day for 1 year, dramatically cut the relapse rate in MS patients compared to those given only 1,000 IUs of vitamin D per day over the same time period, such that 16% of the 25 MS patients in the high-dose vitamin D group suffered relapses during the 1-year period, compared to 40% in the low-dose of vitamin D group, which had 24 subjects in it. And patients taking the high-dose vitamin D suffered 41% fewer relapses within that 1-year period, whereas only 17% fewer relapses occurred in the group given the lower vitamin D dose of 1,000 IUs a day. So, up till now, neurologists have been recommending only 1,000 IUs a day for MS patients. But in light of these recent studies, neurologists are now being encouraged to think about using higher doses of vitamin D for MS patients in the range of 10,000 to 14,000 IUs a day to help as sort of an adjunctive management treatment of the disease. Now, I've noticed the fact that patients who took the high doses of vitamin D during the study periods didn't have any significant side effects, so that's also very encouraging. Now, I've included the links to these studies in the text below. It's just one more illustration of the importance of nutrition and natural medicine in the prevention and complementary management of common degenerative health conditions. Now, for general prevention of health conditions, I suggest that you maintain a blood level, vitamin D level, at 85 nanomoles per liter or higher, which is 30 nanograms per milliliter or higher. Okay, until next time, I'll encourage you to eat smart, live well, and I know you're going to look and feel great. Thanks for watching.